expansion of the mandibular arch using a trombone appliance. So in orthodontics, arch expansion is one of the methods of gaining space. So this trombone appliance naman is a type of mandibular expander which is not typically used but offers a lot of benefit. So let's find out why and learn more about this appliance. Mandibular arch crowding is frequently observed in patients with malocclusion, which occurs when the dental arch perimeter between the first permanent molars is insufficient in length to permit the alignment of erupting permanent teeth. So, bakit nagkakaroon ng insufficient in length? So, say for example, there is an early loss of deciduous tooth. So, kapag tumubo na yung first permanent molar, magme-mesial drift siya. So, yung successor nung maagang na-loss ng mga deciduous tooth, insufficient yung length niya, hindi siya masyadong fit. So, crowding is a factor for whether to perform extractions during orthodontic treatments. The treatment plan for mandibular arch crowding must take into consideration whether the results can stably maintain. So, sa pagtitreat ng orthon, hindi mo naman kailangan porket may crowding, hindi mo naman kailangan mag-direct agad sa extraction para mag-gain ng space. Kailangan mo pa rin mag-consider ng ibang treatment or mas conservative. So, how? It is possible to gain space required for leveling crowded teeth by early space preservation. For example, through conservation of leeway space. So, what is leeway space? Let's recall. So, it is the difference in MD diameter of deciduous teeth, CDE, and their permanent successors. So, ano yung pwedeng example or treatment? So, yung mga space maintainers such as mga band and loop space maintainer or LLHA or lower lingual holding arch. Or so it could be also proximal tooth reduction by stripping, rapid palatal expansion, and lip bumper therapy. So why is it more difficult to induce change in mandible than in maxilla? It is because the structure of the lower jaw is compact, which makes it more resistant to orthodontic and orthopedic forces. So, diba, yung lower arch, it doesn't have suture to close. So, the bone cannot be expanded. So, instead, the lower expander simply move the teeth. So then, it will upright the teeth that are tipped inward. Mandibular dental arch deficiencies in growing patients are commonly corrected by the use of orthodontic expansion, such as Swartz device or functional devices such as lip bumpers. So, the following case report describes the successful treatment of female with class 2 division 2 malocclusion by using a trombone appliance. So there, diagnosis and etiology. So, a 14-year-old was referred to the Department of Orthodontics for correction of crowded anterior teeth. Extraoral examination revealed a symmetrical convex profile. So here, it's convex. So, intraoral examination showed a class 2 division 2 malocclusion. Here, diba? Tapos nakaprotrude talaga yung canine. So, with a 1 mm overjet and 3 mm overbite. A 4 mm mandibular midline shift to the left. Ito yung mandibular midline niya. Here. So, sobra na siyang deviated to the left. Anterior crowding of 6 mm in mandibular arch and 4 mm in maxillary arch. And a displaced right canine caused by a severe deficiency in arch length. Lateral cephalometric analysis revealed a mild skeletal class 2 malocclusion with the following record of A and B angle of 4 degrees, and also a retrocline mandibular and maxillary incisors. So here, okay. So, the main goal of treatment was to increase, of course, the length of maxillary and mandibular arches by correcting the inclination of retrocline incisors. So what are the alternatives? First treatment alternative involved distalization of canine after extraction of maxillary and mandibular first premolars to eliminate crowding. However, after evaluating the patient's profile at extraction was unnecessary daw, and that the molar relation and midline shift could be corrected through the use of trombone appliance and intraoral elastic. So, hindi ka naman agad magdadirect sa extraction as your treatment for as treatment kasi there are other options naman na mas conservative. So, you have to consider the patient's profile, cast analysis, and evaluation of the radiographs such as yung mga pano and Ceph. So, there. So, trombone appliance. So, it is designed specifically to assist anterior-posterior arch development in the maxilla and the mandible. So, since trombone appliance does not interfere with speech and is integrated with conventional fixed appliances, it has excellent potential for adult treatment. So, this design is based on the slide principle with an inner tube, sliding freely with an outer tube to extend or contract the length of appliance in mechanism similar to that of slide trombone, from which appliance derives its name. So here, so diba slide principle para siyang trombone, ito yung silicone tubing niya. So ito yung pinapalitan para ma-adjust kung yung sa arch development. So molar section of the appliance is retained with double lingual post and include a vertical tube attachment for insertion of the trombone section of the appliance. So here, nandyan yung double lingual post. So there. So the appliance is pre-activated to achieve initial amount of expansion required. The mechanism is reactivated every 4 to 6 weeks by replacing the silicone tubing with a new tube of an appropriately increased length until the arch form is corrected. So, every 4 to 6 weeks. Pero sa case na to, for every 4 weeks siyang regular visit sa dentist. So, the distal portion of the wire is recurved and retained in horizontal sheath on the molar band that extends mesially at the gingival level to engage the anterior segment of lingual arch. So the absence of frictional forces allows the rapid tooth movement using gentle, controlled lingual forces. So there. Yan. Sa patient. So ito yung mga parts ng trombone. And then here, medyo develop na yung pagka-expand ng arch niya. And then there. Okay. So, treatment progress. So, initial treatment phase consisted of expansion and distalization of maxilla to correct the arch form and adjust the malocclusion. So, in the maxillary area, gumamit ng quad helix appliance. So, it was fabricated from a 0.036-inch orthodontic wire and was soldered to molar bands to expand the maxillary arch and align the anterior teeth in a fixed orthodontic treatment. So, cervical headgear also was worn by the patient 12 to 14 hours per day to distalize maxillary molars. So, ito yung quad helix appliance and cervical headgear. Example lang yan. So, for the mandible, dental expansion was achieved using a trombone appliance. So, 3 days prior to the fitting, separators were inserted. The appliance was positioned along the lingual outline of the mandibular incisors. So, there. And inserted into the molar tubes and fitted into the horizontal lingual sheaths of the molar band. So, here. So, after 4 weeks, the trombone appliance was activated 1 mm per side. So, how? So, how does it work? How does the trombone appliance work? So, activation was achieved by replacing the silicone compression tubing with tubing that was 1 mm longer. Once every 4 weeks to provide 1 mm activation per month until the desired amount of space was achieved. So, ito yung pinapalitan. Here, silicone tubing, diba? Clear siya. So, every 4 weeks or a month, pinapalitan siya ng mas longer ng 1 mm para hanggang sa ma-achieve yung desired amount of space. So, after sufficient space was obtained, the mandibular left canine was bracketed and aligned within the arch. Nai-Tai arch wire were used for initial leveling and alignment, whereas rectangular stainless steel arch wires were inserted to achieve acceptable occlusion. Class 2 and Class 3 elastic were also used to correct the molar relationship and midline shift. So the patient was seen 4-week intervals during active treatment. After 13 months, functional occlusion and favorable aesthetics were obtained, and the edgewise appliance were removed. So here, there. So it was removed na. So somehow nag-improve na, right? And here, let's take a look. So yung red is yung pre-treatment, and the blue lines are the post-treatment. So, di ba, kitang-kita nag-distalize yung molar. So, there. So, retention was accomplished by the use of maxillary removable retainer and mandibular fixed retainer. And follow-up visits were conducted once every 6 months. So, 2 years after retention, an acceptable occlusion was maintained without any marked relapse in occlusion, which indicates long-term stability of the occlusion. So, there. Yan. And then here, yung post-treatment niya, yung red, and then the blue follow-up visit for after 2 years. So, diba, it was maintained without any marked relapse. So, there. So, in conclusion, the trombone appliance was effective for correcting mandibular arch crowding and represents an acceptable method that can be used successfully in young patients with early mixed dentition as well as in adult patients with permanent dentition. So this trombone appliance is considered a slow arch expansion or dental-alveolar expansion. So changes are primarily of dental changes with minimum amount of skeletal changes. So there. Thank you.